Welcome all to another Artificial Intelligence in Healthcare podcast episode. I am your host, Matt Kinn, Segment Development Manager for Healthcare here at Access Americas, and I am joined by Mr. Eric Shanclay. Eric is the Vice President of Memorial Hermann Health System. And Eric, why don't you tell the guests that might not know you, I think most do, a little bit about yourself.
Thanks, Matt. Again, my name is Eric Shanclay. I am the Vice President of Security at Memorial Hermann Health System. I'm the immediate past president of the International Association for Healthcare Security Safety.
Fantastic, yeah. And you've had a pretty long tenure in the security space. You want to tell the audience a little bit about that too?
Sure. Probably for the last 10 years, I've worked in healthcare security. Prior to that, I've been in law enforcement for about 30 years at the local, state, and federal levels. Worked overseas for several government agencies in places like Iraq and Afghanistan, throughout Europe.
Quite tenured.
Yeah, a lot of interesting times.
And I'm super grateful that you were able to get into this. I know you were super busy, and I think it's just awesome that you're able to make this podcast. So
it's my pleasure. I'm glad to be here. Thank you.
Absolutely. I'll do the quick housekeeping thing, and then we can dive into it. Okay. So for those of you joining this podcast series for the first time, this is a series mostly around dialogue, around the use of artificial intelligence-based technologies in a health system. I believe pretty firmly that this type of dialogue is very crucial to the success of an artificial intelligence-based program because there's a lot of context, there's a lot of nuance, and there's just a lot happening in this space, and I don't think that people have the conversation enough exactly how this technology will work with humans in the space. Okay. I want the conversation to take us where it may, but a couple of the things I'm hoping we get a chance to discuss is going to be, common problems we see across these health organizations, workplace violence, specific that of like patient-centric violence, yep. And then, what people really like is if the world was according to Eric, what would be a perfect AI system for you? It would
be a perfect world, I feel like, at that point.
It could be. It could be. But I think that that's kind of a fun thing, but it's also interesting too because a lot of times people need to know where everybody else's head's at. Mm-hmm. And I think a lot's changing in this space when it comes to like efficacy within these models. Customers are asking for more. They're doing AI intake forms. So I think that's some things to consider as well. So I consider myself pretty fortunate. We get to work with a lot of different healthcare systems, but no, not to the volume or level that you do. Mm-hmm. And some of these places have geographical challenges associated with their programs that are very specific to their environment. Sometimes it's patient populations.
Yes.
But then there's these other problems that everybody has. And you, being as traveled as you are with your time in this industry, as well as you've spanned cultural these barriers, like you go well beyond that. What are some consistent problems you're seeing that these customers or hospital systems are facing?
Sure. I think if you ask any healthcare security leader or probably anyone who oversees a healthcare organization, the biggest issue is going to be workplace violence, typically patient-generated violence, which is the biggest segment of violence that we see. I think other things would be just burnout and retention of your employees, and a lot of that, again, is driven by workplace violence. Cybersecurity threats, we saw the hack last year. That was a big issue for us, billions of dollars lost at that point. I think supply chain disruptions are another thing, as we saw during COVID, making sure that we have the right supplies that we need to be able to treat patients. But again, I think that patient-generated violence is probably the biggest threat that we have to healthcare security and healthcare that we know.
So if I asked you to unpack that just a little bit more, when you say patient-centric violence, like what are some of the characteristics, like for people to help define that? What would it's more than just the patient acting out. Yeah. There's a lot that leads up to it. I'm also seeing there's a lot of interest in people trying to catch things early, like while they're escalating. Can you just unpack it just a little bit more?
Certainly. I think, my friend Tony York had generated this term several years back when we were working on something, but patient-generated violence is just violence committed by patients. And the reason we wanted to use that term was we thought it was very specific to healthcare. When you talk about workplace violence, people look at just workplace violence as a whole across a broad spectrum of industries. But patient-generated violence is about 73% of all violence that's reported to OSHA each year is in the healthcare space. So we wanted a term that was very specific to healthcare so that we knew exactly what we were talking about. and we didn't get drowned out with the noise of other industries as well.
Yeah, and do you think it's a growing trend, or do you think it's just getting more awareness now?
I think it's probably growing. I think there is greater awareness. A lot more people are talking about the problem today, but anyone that I've spoken to in this industry has said that they're seeing more and more violence. Really started to pick up after COVID or during COVID, but now it is just it's a huge issue. And even though we're talking about 73% being reported to OSHA, we know that for a variety of reasons that that number is grossly underreported, and the number is significantly higher.
I want to expand on that. You mentioned underreported. Mm-hmm. How are you recommending people promote the awareness, like in actually reporting an incident? Because I think sometimes within these organizations, and I'm talking specifically the care teams, or it could be other members of the organization, they don't want to report it because they don't want to get bogged down with paperwork. They don't want the follow-up. They don't want the issues, which I think just compounds the problem. But like, how are people being encouraged to actually doing, like, follow through and reporting it?
Well, I think, some of the barriers to reporting quite often are caregivers got into the industry because they want to provide care to people. They're very tolerant of workplace violence or patient-oriented violence, thinking that it's just part of the job, which it's not. I think some of the other issues are it's not easy to report workplace violence sometimes. There is a cumbersome process. Other times, I think it is they don't feel that the organization is going to support them. And then also issues around, is anything really going to change at the end of the day if I report workplace violence incidents? So to me, what we're trying to do is really around the education piece and explaining to caregivers that workplace violence is not a part of the job, that you do have the right to have a safe environment for providing care. Making the reporting, again, as easy as you possibly can. We have multiple avenues to report workplace violence because we want to know. The importance to us as an organization, as a security professional, is that I can't develop the proper workplace violence mitigation plan if I don't know exactly what's happening. For instance, I originally, when I got into healthcare security, I assumed that Friday and Saturday nights are probably when I'm going to have the most incidents of workplace violence. People are off, they're out drinking, things are going on. But I found that typically for our organization, Tuesdays and Thursdays, that's where we see the most violence.
Really? Why do you think that is?
I could not tell you, but I know that that's what I want to schedule the vast majority of my officers. We want to be proactive. We want to prevent things from happening. So we try to use smart scheduling. And if we don't know the scope of the problem, the hours in which it's occurring, the units which it's occurring on more often, we can't really address the problem to the degree we'd like to.
That's fascinating that those are the days. And I imagine everybody's kind of got that similar. It could be different days based on just what people are doing.
I think it's just you look at the numbers and your incident reports that are coming in, the different things that are occurring, and you try to smart staff based on that.
And then you have your overlapping based on your peaks.
Yep.
I got it. No, and so I think, are they doing anything like with an onboarding process to communicate to the care teams that they need to report it? I mean, are you getting buy-in at that level? Is it something that you think people should do? It's just.
I think it's an ongoing process. You certainly want to start early with encouraging reporting of workplace violence. You want to continually communicate that meeting. I think for me it's really effective if you can have someone like your CEO, someone who is within the administration of the organization, reporting that to people, making sure that they know that's a top-down approach, that we want to know what's going on. We want you to feel protected, so we need you to tell us when these incidents are occurring.
It's for everybody, right? That makes perfect sense. We get a lot of requests, I would say, for some pretty unique models. Mm-hmm. And some of this is coming from the concept of we both work with security teams, the officers, and we also work with care teams, bedside staff. And where we're seeing a pickup for a significant increase in demand for stuff inside the patient room. It seems that there's a significant level of escalation that occurs within the patient room, and it's hard for typical securities programs to really, I would say, understand that they got to go in the room.
Yes.
And so there's a lot of technologies out there, and I think with what you see, the investment within these organizations around patient engagement technologies for like calling room of tomorrow or the room of the future, which is not, I shouldn't do hand quotations, but that's what people are calling. They call it a lot of different things. And it's the room of today in my head, because we're working on things so far out and there's all these different things that people can engage with. Mm-hmm. I mean, we're talking smart blinds, ordering food, care boards, ambient listening, so for like auto dictation, we're seeing remote patient monitoring, we're seeing virtual nursing, it goes down the list. And there's a common denominator when it comes to sensors being used for these types of technologies. There's a camera, microphone, and a speaker in all these rooms. Even if you're just doing ambient listening, there's at least a microphone and a speaker. How, if you're a security director, officer, or you just want to be part of those conversations of this technology stack going in, so you could be a tool that security could also use, how would one go about getting involved in that conversation?
I think you're probably going to have to ask for a seat at the table. Quite often, security is not looked at as someone who could contribute to the build out of facilities. We get some of the low voltage work, but really in developing that new patient room, I think being able to come to the table and say some of the technologies that we would like to see could include this, and I think that a lot of it, there's overlap because we're going to use it for a purpose. Caregivers are going to use it for a different purpose, but however, it works for both of us. So making sure that we have an understanding of what's going into the rooms, what we might like to see added to the rooms. So I think just really trying to be engaged as a security leader and being able to have that sort of input to me is very important for us.
And communicating the successes when there is a success. I remember we had Todd on, and he was talking about communicating the successes, and always in perpetuity, always communicating the successes. I think that that's a big understanding too. Nobody wants to be, think that somebody doesn't have their back with any of these organizations, and so I think asking for a seat at the table makes a lot of sense. I will say hospitals are siloed. They're brutally siloed within these organizations. It's not just hospitals. You could pick your poison. You can do anything you want. They're all siloed. But I think, like you said, asking for a seat at the table so they can understand your goals and where they're going to overlap and they benefit everybody. I like that. What other, okay, so let's go outside the patient room. What other workplace violence AI models are you seeing people implement? And I'm not saying just implement, but like actually move the needle.
Certainly.
Like what's making an active difference right now? What seems to be the biggest win?
I think there's a lot of different things that people are bringing to bear on the problem. Today, I think AI-enabled video analytics are a great tool. They allow you to see things that the officer may not see. You're watching a lot of cameras sometimes, you're very busy with other things, you're answering the phone, but the analytics and the cameras are constantly monitoring what's going on. So they're looking for things that could be suspicious behaviors, potentially signs of someone escalating based upon their movements, people who leave unattended bags, things like that could be a concern for the security team. So I think those are some of the great things that we're seeing. I think also AI-enabled incident management systems are a great thing as well because it's constantly looking for patterns that we may not see. We know that, say we've got 3,000 calls for service in our ED last year. That's going through and it's looking for what kind of patterns that I see. Are we seeing things that may help us better staff and better anticipate issues that could be occurring? I think the real-time surveillance, again, AI is constantly watching the cameras, looking for those sort of things. So that I think has been great. I think weapons detection, that's a huge thing.
Right.
Everyone's talking about weapons detection these days. AI is enabled in that, so it's not your walk-through metal detector of yesteryear. It is something that's actively looking for shapes, densities of metals, things like that. It's able to let things like keys, phones, things like that go through. So that is another huge thing that I think, again, you're going to see in the future will be part of everybody's security management plan. I think that duress alarms, that's another big thing. Wearable duress alarms, different technologies like that can monitor or allow us to know when there's a problem, but could also potentially in the future monitor behaviors and things like that. Like the Apple phone, I know if you were to fall down, it notices those sort of things. I think duress alarms will probably see able to do those sort of things again, looking for movements. I think that real-time location systems, that's a big thing that especially when we're looking at duress alarms and things like that. So if a caregiver is moving from one place to another, whether they're being taken by someone or they're trying to escape, it allows us to see where that person's going and potentially get to, we're not going to where they were, we're going to where they're headed towards. So I think that's a great thing as well. I think that there's potentially in some of the EMRs a patient risk assessment that is looking for behaviors in particular patients, looking for different signs of potential aggression that could be seen in the future. So I think there's a lot of technologies really that we could be using and that we are currently using, but I think again we'll grow the use of and the capabilities will get bigger in the future.
There's a few things you said there. That was awesome. But I want to talk about a few of those things just a little bit more. So I want to talk about weapons. I want weapons detection most certainly. I want to talk about the EMR. I want to talk about falls. Because everything you said is fantastic. How big of an issue is falls within a hospital? I mean, I know it's the number one cause of injury, but like for the security teams, like how much is that a burden?
I don't know if it's necessarily a burden. It's something that we definitely we keep track of. We look for reasons behind those falls. Was it a design issue, something, or was it something that was left, water on the floor, things like that. So we're always looking to limit the liability of the organization, looking for how those things occur. I think for me, the fall detection, really the interesting part will be as we move into these wearable duress alarms and things like that. So it'll be looking for if you had a medical emergency or you were assaulted and you don't have time to hit that button, but the device notices that you're laying on the ground, it automatically could notify security and security could get there to help.
Yeah, with the accelerometer.
Yep.
Yeah, when it flips. Yeah, no, that's... And you mentioned something about EMR for a patient escalating. I remember I just filled out a survey. I think it was like last week or this week. They're blending together. Either way, for an ASIS thing. And it was a survey that had one of the questions was, and they want to talk about specifically that for like the hospital security director's team, they wanted to talk about EMR integration to be able to pull data out of that and get it into the security officer's hands. And I think it's more like at a dispatch level, if that makes sense. Something in an SOC.
Visitor management.
Visitor management. That is, yes, absolutely. And so I could totally see that workflow. And so it's one of those things where there is a wealth of data within that, and the care teams they're actively populating that data in live time, being able to get that type of data out as it's relevant. And I'm not saying like unnecessarily, just relevant data. So escalating, high propensity of fall, maybe they need things of that nature, I think make a ton of sense. I can't see that come to life fast enough, in my opinion. There's breadcrumbs and framework today to do everything, but it's one of those things where actually functionally doing it is a different world.
Certainly.
The other thing that you talked about was weapons detection. And I'm going to quote Paul Barata. You remember Paul?
Certainly.
He talks about it. It goes, people, process, technology. And I very much, in that order, should types of technologies be implemented. And I believe that for most workflows, it really should be supported that way, because the intelligence models aren't all that like wildly intelligent. They're not doing independent thinking. They're not going to assess intent. It's not possible.
True.
We're not there. I don't know that we ever truly will be, and that'd be hard to explain to anybody. But this concept of, with a visible weapon, it is an emerging technology to detect that. And that is evolving over time, and I think people really need to understand the limits of what that technology could do by itself. I think layering of like physical screening processes, things like that, one doesn't replace the other.
No.
And one doesn't replace a human operating that system to engage, interact, and intervene if needed. It doesn't replace any of those things. It's just a data point. If that makes sense. And that's kind of where I see that technology staying today. In my experience, certain types of firearms are more detectable than others, postures matter, all these different things. And I think they have to test it. They really need to test it in their environment before they deploy it.
Agreed.
But when you say people are super interested about it, what is have they communicated what they hope the outcome to be?
Well, I think, of course, the outcome that they're hoping for is to reduce, if not eliminate, the number of weapons that are coming into the facilities. But I also think a big part of the weapons detection benefit is the reduction in anxiety that you have of your caregivers. If they're not worried about their safety to the degree that they would be if they didn't have the weapons detection system, I think that they're able to focus on providing quality care for their patients. They're able to ensure that there are better outcomes at that point because they're laser focused on that. I also think that there's just other benefits to having the weapons detection system in your facility, and that could be just, again, if it's not just the keeping the weapons out of the facility, it is just the overall impression that people have is that it's a safe space. And what we really want is for our organizations to be those safe spaces that people can come to in the community for whatever it is that they need. And it is, as you mentioned, kind of a concentric layers of security that, as we look at, that's one part of our efforts. The weapons detection system inside the facility, the officers that are operating it, all the other things that we're doing, the cameras, the access control. I think that the analytics and cameras, as you talked about, they're not necessarily there yet, but I think it's a fantastic tool. It's going in the right direction. I like the ability to potentially have 90 seconds, 120 seconds to interact with someone before they make it to our building. If they're manipulating a weapon, yes,
yeah.
correct,
Yeah.
in the parking lot, if they pull out a gun or they are doing something that catches the eye of the camera, I think it's great for us to be able to meet that person in the parking lot prior to them getting into the facility, and then it could potentially become a bigger problem at that point.
And you kind of have, what I'm gleaming from that is that there's layers in there. Mm-hmm. It's not only defense in depth, but there's also humans making decisions
Correct.
based on data, knowing that it's never going to be a perfect system. It doesn't exist. 100% accuracy is a wonderful goal.
Certainly.
I don't know that that's there. It could be in the future, right? Those things, with such demand around it, I see it evolving. But I think a lot of times people look at a YouTube video, or they see an ad, or they see a point on a data sheet, and they go, "Oh, solves my problem." And it's like, you got it. No. You have a lot more to figure out in that program than
Correct.
just implementing this. So, and we don't control the hearts and minds of people coming to use space. That's
Correct.
the other thing too. We're dealing with the wild. Like it's out there. So, speaking of wild, if the world was up to Eric Sean Clay, what would a perfect system be?
Well, if it was up to me, we wouldn't be necessary to have any of these systems in place, of course. But I think that using the systems that we've got today, I think is great. I think we'll see other things that will be added to the arsenal that we have. Again, I think that AI and machine learning are going to really move the needle on this significantly. I think that things, there's some controversy around things like facial recognition.
Right.
But to me, that I think you'll continue to see that the use of facial recognition grow in different capacities, whether it be for security uses or targeted marketing. I think there's all kinds of things that we'll see with that occur as well. I think for me, again, it would be just utilizing the technology we've got and then seeing what that future generations look like and how much more refined and how much better we'll be able to use those things to better protect people.
And I think too, and so when you say acceptance of it, I want you to unpack that just a little bit more. Are you talking like a trust perspective, or like are you talking more benefit perspective?
I mean, I think the benefits are there. I think it's the trust. People, often have concerns about how these devices are used to capture likenesses and to identify them. They think that there's potentially some uses they wouldn't agree with. But to me, I think it'll continue to grow. I think it'll continue to be something that is used. I mean, you open your iPhone, it's using facial recognition. Different devices are already using that thing, using that capabilities. But I think it will continue to grow. I think it will benefit us in a number of ways. Is that it's like LPR, license plate readers. I mean, it gives us an idea of who's on property. If we're looking for someone or law enforcement's looking for someone and they go past an LPR camera, we know the vehicle's there. I think facial recognition could be used along that same vein, is that if we have someone who says, I'm going to come and I'm going to shoot you up to your hospital, being able to utilize the cameras to give us the opportunity to see that person the minute they step foot on our property allows us a better opportunity to prevent them from doing what it is they want to do. So I think that hopefully we will get to the point where we'll be able to use these technologies in these ways that will be better accepted by people as we're using them for their protection, not necessarily for anything beyond that.
Yeah. They have to understand that it's there to help them, and they're working with people that are to be trusted in that
Correct.
space. I think that's huge. And I mean, and not everything is not everything warrants it, as you understand. It depends on the workflow, it depends on the sequence. But if you have like a very specific threat, not a vague threat, like an actual, you're like, okay, this is detailed.
Yes.
Then it moves up in the escalation world as well too, because it becomes more validated at that point.
And we use things like BOLOs to look for people right now. So we're putting the pictures in the hands of the officers. But again, AI-enabled cameras are constantly looking for that information to show up somewhere and then tell us where it's at. So to me, of course, it would be much better for us to be able to utilize that sort of resource in order to keep people safe.
And I also see this a lot too. I've heard a lot of hospital systems talk about trafficking and the use of facial recognition to assist with that problem.
Yeah.
It's an ugly topic, but it's a powerful tool.
Exactly.
If implemented correctly, set up correctly, within the bounds of ability, like actual functional abilities with today's technology. And it changes.
Children, I mean, there's all kinds of
The
things.
missing children.
Should they come into the ED or something like that, if we were able to recognize them and help protect or save those people as the human trafficking or someone's been kidnapped or anything along those lines, to me it's a great technology that would help us solve some of these problems.
Look, I completely agree with you. And as far as efficacy associated with implementation of these things, we're seeing a lot of things come down with people asking intake questions. And I see this a lot on the care team side, but I'm starting to see it happen to the security teams where they're actually sending manufacturers, vendors that are people that are generating a model and selling it. They're actually sending them out something called an AI intake form, where it's stating like, what is the ground truth? Do you own the data? How did you test this? How did you make sure there's no biasing associated with it? I think the industry as a whole needs a guiding principle in that space, and I would like to, what are your thoughts about that?
Yeah, I would tend to agree with you. I mean, I think to me it's interesting when you see these studies that come out and they say that AI does have a bias. You would think that there would be X's and O's. It's either it is a 1 or a 0. So it's interesting to me that even these technologies can have a bias. So I think yes, definitely we want to use these in the proper way. We want to make sure that the benefit outweighs whatever negatives there are. So I think that definitely having these things in place makes the product better, more useful, and it makes it fair to everyone, I think.
Well, and I also think it's important too from that aspect that the people that they're working with, they should be able to show their cards. This isn't something generic that was quickly slapped, because that's what shakes people's confidence, and I think it's going to put a bad taste in a lot of people's mouth. And the more questions that can be asked around that, the better. Also, it helps you protect your program.
Certainly. Saying
we're working with the most reputable people we can. This is our criteria. I mean, the EU has criteria. The United States, we have some things, not quite like the EU per se, but there's some good stuff there that people can pick from and find what makes sense for them and then use it. Well, Eric, this was fantastic. I really appreciate you being here. I hope everybody listening in found this valuable. Please join us on more to come. And also, if you haven't seen some of the past ones, be sure to go to the Axis YouTube channel and look up the podcast series. Thank you.
Thank you.